Very clear, very concise, and I'm sure there'll be questions. So you've actually teed it up very well for my next question to Alan first and then to Glenn. Peter spoke about the unfinished task. Spurring innovation is one part, but what about the pull? And if I think of Chai, and if I think of you, Alan, and your team, you guys are experts in market dynamics. You've addressed market failures. You've created new markets. You've created very innovative mechanisms by bringing in exactly what Peter was talking about: domestic governments, donor community, and industry. What's your formula?
Thanks, Renuka, and thank you for inviting me here. And some apologies to those of you that I know and work with on a day-to-day basis. If I'm reading from my notes from time to time, it seems like a lot of what we say that has Clinton in it gets very close scrutiny, and I want to make sure I stay off.
Just tell us who Chai is first.
Right. Some history, okay. The foundation of Chai back in 2002 was focused on the transformational goal of trying to save lives of millions of people living with HIV/AIDS in the developing world by dramatically scaling up antiretroviral treatment. And when at the founding, which is what, a good 15 years ago, I think the general view was that this was an unreasonable goal because health systems in poor countries were too weak to manage this kind of a program, and the prices of the relevant drugs and diagnostic tests were much too high. So Chai played a leadership role working alongside governments and other partners to lower the costs of treatment and build in-country systems necessary to providing life-saving treatment to millions of people. Chai has achieved many of its most important successes when seeking to fundamentally change the way the world approaches an issue and pushing the boundaries of what is considered feasible in global health. And we are committed to strengthening integrated health systems, expanding access to care and treatment in the developing world. So since our inception in the area of HIV, more than 11 million people in 70 countries have access to prices negotiated by Chai for HIV medicines and have led to more than $3 billion in savings. And from a private sector perspective, the market for generically produced drugs in the developing world has grown from essentially zero to over $1.8 billion per year. In 2005, Chai, in partnership with Unitaid, pioneered the diagnosis and treatment of infants and children, and in the first 24 months were able to identify and treat over 50,000 children. Today, some 750,000 infants and children are receiving HIV treatment, with Chai having worked to reduce the cost of pediatric AIDS drugs from over $600 per year to under $150, while partnering with innovator and generic firms to introduce new formulations such as flavored dispersible pills that better meet the needs of infants. Our solution-oriented approach focuses on improving market dynamics for medicines and diagnostics, lowering the price of treatment, and accelerating access to life-saving technologies. Currently, 1,500 people working in 35 low and middle-income countries with programs in TB, hepatitis, maternal child health, and malaria. And now to answer your question, I think we like to describe it as simultaneously engaging on the demand and the supply side of the public health issue. On the demand side, I think this is really the most difficult area for the private sector, and the tombstone across many the script on the tombstone for many well-intentioned efforts has been a misunderstanding of fundable demand and the appropriate product definition. There are no IMS reports or Gartner reports about how much somebody will buy of the type of products that Peter is describing, and many other very conventional drugs, diagnostics, and medical devices. So what I found working at Chai, coming from the private sector, is that having a network of 35 offices that are working closely with the Ministry of Health in the major low and middle income countries gives us a unique perspective on what is going to get funded, what are the real priorities on the ground, what is the ability to expand capacity or the need to build capacity for a particular innovation to be utilized. So that work of accurate demand forecasting and being realistic, not about unmet need, because there are all too many unmet needs in the developing world. It's what is the fundable need that's going to be met, particularly in the short term as a new product is launched. The second thing we do on the supply side, and much of our work is with products that already exist or are about to come to market, is to look very carefully around the world at what does it really cost to make the intervention in question, whether it's a drug, a diagnostic test, or a medical device, And not just look at it in a static fashion, but to consider it dynamically. If the volume was 10 times as high, if there was a single purchase order that covered 5 years, what might it cost then? Or if we changed the packaging, if we took some of the uncertainty out of payment and procurement. So to really get beneath the current buyer behavior, if you will, and production behavior, and to see what is the scope for optimizing that. And then if we think that there is a match between what something could be made for and how much might be bought if that new price was achieved and the product specification was correct. And I think each case is different, and you've been part of these things, as Gary and others. It's a coalition of the willing that will come together so that the procurement groups, the donors that actually provide the money to the procurement groups, because remember, the Global Fund is 1/3 funded by the US, a heavy proportion by Sweden, Norway, the UK, France, et cetera. So the donors are the same, even though there are a lot of institutional structures. And the procurement groups there's a small number of them, but it's sometimes quite difficult to coordinate their behavior. So trying to bring everybody around the table with the common purpose of improving a public health outcome and dramatically scaling the uptake of a commodity has proved to be a very workable formula. So from the very simple comments that President Clinton has made from time to time about we can reduce margins but greatly increase the volume. We've seen that in AIDS drugs, we've seen it in diagnostics, we've seen it in other commodities. If you can go at 10 to 100 times the volume and build the infrastructure, sometimes the production economics can be greatly improved, and the real benefit is measured then by how many patients are receiving the intervention. And that's the key thing that we keep a focus on.
Excellent.